Hey everyone, welcome to another video looking at anatomy, kind of laser focused anatomy and how we can use the anatomy to get the most out of our laser treatments. In this one, we're going to focus on the shoulder joint using my friend here to help kind of demonstrate some of the techniques and tips to help you get the best when you've got to treat the shoulder. So obviously with the shoulder joint, we've got the scapula and we've got the humerus. Apologies, our anatomy is a little bit twisted here. But we've got obviously those two major bones. We've got the point of the shoulder, the greater tubercle, and also the acromion process and spinal scapula, which is another kind of area for palpation. Um, in terms of, muscles, ligaments, nerves, we've got lots going on. Nerves, the ulnar nerve, radius nerve, subscapularis, lots of nerves going on here. And again, we'll focus on those in a different video. And again, in terms of muscles, we've got traps, our rhomboids, we've got obviously our infra and supraspinatus muscles, our lats, our deltoids, our biceps, triceps, and lots of other things going on as well. And again, we'll focus on muscles in a different video. So I just want to look at the actual structure of the bones. And what's really, makes the shoulder different to all the other joints is the fact that there is no bony attachment here. It is muscles, tendons, and ligaments. And that's what can be a little bit challenging with treating the shoulder joint because, often these tendons, ligaments that are all at the back here holding that on, very difficult to get access around the back here. So obviously we can impact all our kind of superficial muscles that are on this lateral aspect, but trying to impact anything on the medial aspect can be really quite challenging. Again, if we look at the joint itself, again with the shoulder, we're not going to get that great medial aspect. So we're often focusing on our cranial-caudal and lateral elements. And again, if we kind of look at, direction. So, if we've got our patient just in lateral recumbency, which again is my preference when we're treating the shoulder joint, again, access wise is going to be fairly limited within that joint space. If we again look at just our cranial view, apologies, it's not so easy to show you on this model, and our caudal view, again, quite limited. But what happens when we start putting this shoulder into flexion, into extension, then we start getting a bit of an opening within that joint cavity. So if that's your target, to get into that joint space, then really think about your flexion extension as you're treating to get into that joint space. Now, there's tons of different conditions that affect the shoulder joint. Many of them are soft tissue. So it's again transforming that knowledge. Okay, well, if I want to hit a specific muscle, if I've got bicep issues, tricep issues, medial shoulder syndrome, how am I going to be able to target those muscles by putting it into flexion extension, pronation, supination? Does that help the access a little bit better as well? The only other element to also think about is, we are going to try and get that medial aspect if we can. So obviously, if you're able to, with your probe, trying to come up and into the joint space here, and also sometimes not forgetting to kind of come right up to the edge of the scapula up here. And again, depends on that patient, depends on how much movement we've got within that shoulder joint. Sometimes giving a good treatment along the ridge at the top here. Again, can we relax some of those muscles to help us get different access? It really depends. It's going to depend again on wavelengths we're using, power we're using, and all those great things. But shoulders are not easy to get around there, and I think hopefully just looking at what you're wanting to treat, think about what position can you put that shoulder joint into to give you better access there. Also, don't forget to treat kind of over your lats, obviously in this region, because again, that's naturally going to be affected. And as always, I always treat the spinal segments above the limb that I'm treating as well, because of course these cervical thoracic muscles are going to be really quite sore as well. So it's not just about treating the shoulder joint or even the elbow or carpus. Always treat that spinal segment as well, because we're naturally going to have that weight's going to be shifted and it's naturally going to get sore for them. So hopefully that helps when you're looking to treat the shoulder joint.